Conservative estimates indicate that 25 to 30% of the population suffers from temporomandibular joint disorder, commonly known as TMJ. If you include those that have signs of TMJ but no pain, it gets closer to 70% of the population. TMJ affects the head and neck and could result in a myriad of chronic pain issues such as headaches and migraines, facial, neck and back pain, postural changes and problems, ringing in the ears, clicking, popping, and locking of the jaw joint, pain behind the eyes, sleep disorders, and even an inability to breathe properly. These symptoms often go undiagnosed by medical doctors, and this is where neuromuscular dentistry plays a vital role in properly diagnosing and clinically resolving these chronic pain issues.
I felt like a new person.
More importantly, I was getting my wife back.
My name is Mindy Day Hodges. I am 40 years old and live in Los Angeles, California with my husband, Clinton. My most memorable experience in my career is definitely when I served as a volunteer with the United States Peace Corps. I knew even at the age of 4 that I wanted to be a Peace Corps volunteer, and fulfilling this dream was a necessary way for me to fulfill this lifelong goal. The catalyst for the deterioration of my health was really as a result of an elevator accident back in 2000. Essentially, once I got on the elevator, the cable broke, and when it finally came to a stop, and I would say it stopped abruptly, I noticed a tremendous amount of pain in my low back and hip area.
I worked as an investment banker and private banker. I would come home in the evening after a hard day. She might just be getting up. She might have taken a shower. She might not have. Very trying and difficult time for us, for anybody in a marriage. And it was just one of those things where we never thought she would ever get better.
I was really sick, and I felt like my body was giving out on me for no reason. And I had back issues. I was on a feeding tube, several different feeding tubes. I had been in and out of the hospital many times, sometimes for, a week or two at a time.
We almost gave up hope, and we were at our wits' end until we chanced upon a doctor named Doctor Solomon, who had this, really, he comes from a dentistry background as opposed to, say, a spinal surgeon or something like that. What he did was he created an orthotic for her mouth, and I'm no doctor, but I know that for the first time in our marriage, I saw a difference in her, like night and day, where my wife was able to actually get the oxygen, it turns out, is what she needed.
I first saw Dr. Sid in his office, and I was fit with an orthotic, and it's an oral orthotic that I wear 24/7, and he assured me that this is what I would use to treat my condition of TMJ. What I did not realize is part of TMJ means potentially that the patient is not getting enough oxygen, and I'm speaking out of personal experience for me. When I was fit with the orthotic, immediately the first 3 nights were very profound. I could not believe how much more oxygen I was getting in my system versus before. I felt like I had like a third nostril or something.
No doctor has the cure for every case and every patient. As a neuromuscular dentist, my job and my duty is to find and figure out the least invasive way to help the people that come into my office.
The last 5 years of my life were tremendously difficult, and the next 5 years I am ready to live for myself and live a great life with my husband Clint and myself. I mean, this is my time. I feel like I gave up 5 years of my life And I don't know why it took so long, but I feel like I'm ready to have a great life again. And I feel it. I have much more energy, and we're making changes as we speak to improve our quality of life. And I'm very blessed that I met Dr. Sid.